Hi everyone. Whenever we discuss about the infertility, it is always meant to be the female infertility in most of the cultures because most of the people believes it is a female issue rather than a male issue. But if we go into figures, we will see that around one third of all the cases of infertility is due to male factors, and also another one third is due to female factors, and other one third is due to both male and female combined factors. So if we are attending to a couple with a subfertility, this is very essential to look into male factors rather than trying advanced fertility treatments. So when I meet a couple, I always go into the male factors and correct them before going to advanced techniques of fertility treatments. Today I am going to focus on 10 most important factors that can improve male fertility. I am Dr. Sanjaya U Jayasooriya, general practitioner and health educator. Also, I am very happy if you can subscribe my channel. Also share your comments. I think you might interest in my last video on how to get pregnant fast with my CTT formula, which helped 50% of my patients to get successfully pregnant. So you can see that video too. 10th most important thing to improve the male subfertility is avoid unnecessary use of alcohol. We have already discussed about the adverse health impact of alcohol use one of our previous video. If you forget all these adverse impacts, the contribution it causes to infertility is very high. Usually it causes a lot of damage to our hormonal systems. It increases estrogen levels in our body in addition to reduction of LH, FSH and testosterone levels in our body. As a result, the amount of the sperms and the quality of the sperms will be reduced. If you are taking alcohol in a long run, it will lead to male subfertility in you. Ninth most important thing to improve male subfertility is the avoid unnecessary exposure to mobile phone radiation. Nowadays, most of the people have a mobile phone. Most of them used to use this mobile phone around the genital area. As a result, they expose these genital organs continue to this mobile phone radiation. So, as a result, this mobile phone radiation causes low sperm counts in your sperm samples and also low quality in your sperm samples. So, if you are interested in improving your subfertility, it is very important to avoid unnecessary exposure of your mobile phone to your testicles and other genital area. Eighth most important thing to improve male fertility is the avoid unnecessary exposure to radiation. We know there are a lot of radiations in our environment. There are X-rays, gamma radiation, isotope radiation. So some people exposed to this radiation in a daily basis, like radiographers, laboratory technicians. So this radiational exposure lead to damage to sperms. As a result, there will be low amount of sperms and also there will be abnormal sperms. If you are having troubles with getting pregnant, please avoid unnecessary exposure to these radiation. Seventh most important thing to improve male subfertility is the avoid unnecessary exposure to heat and vibration. Usually we know our testicles are formed in the abdominal cavity, but these testicles are go into the scrotum somewhere around the birth. This is because to maintain lesser temperature than the body temperature, to maintain proper sperm production. So if you are exposed to heat in an unnecessary level, the efficacy of your sperm production will be reduced. To maintain a good sperm production, it is very important to avoid unnecessary exposure to heat. In addition, there are some people who are exposed to vibration in a daily basis, like drivers. There are some research done in the rats and found to have rats who are exposed to vibration in a daily basis have small testicles with low quality sperms. So please avoid unnecessary exposure to vibration and temperature. Sixth most important thing to improve male subfertility is the maintain a good BMI. Whenever our BMI is increased, usually the causative agent for this increase of BMI is increased level of fatty tissues. This abnormal amount of fatty tissues will lead to abnormalities in the steroid hormone metabolism. Usually these steroid hormones include testosterone, estrogen, cortisol like hormones. So if you are not maintaining a good BMI, you will have lesser amount of testosterone like hormones. So you will have low quality sperms. The best BMI you can maintain is around 80 to 25. But it is beneficial if you can maintain around BMI of 30. Fifth most important thing to improve the male subfertility is the avoidance of external steroid hormones. There are some people like athletes and bodybuilders uses external steroid hormone to maintain their performance. But if you are using these hormones, this will cause failure of production of internal steroid hormones like testosterone. As a result, there will be low amount of sperms in your sperm samples. So make sure that you are not using external steroid hormone. Healthy diet is the next most important thing to improve the male subfertility. Usually nowadays lot of people uses lot of junky foods. These food contain lot of fats, lot of sugars, lot of artificial ingredients. So all this ultimately causes lot of free radical production and damage to your sperm production. So make sure that you are avoiding unnecessary amount of these artificial foods. In addition, there are a lot of antioxidants you can take as a diet. Usually carotene, vitamin C and also selenium like vitamins and minerals having huge role in improving your free radicular damage. So take this either as a food or dietary supplement. Third most important thing to improve subfertility is the control of comorbidities. There are people with lot of NCDs like diabetes, hypertension, ischemic heart disease. If you are having all these, you have to get a proper treatment for this and get control. If you are having these issues, you will have a lot of sexual dysfunctions and low quality sperms. Make sure that you are taking proper treatment for these NCDs. Second most important thing to improve male subfertility is avoid unnecessary medications. As we know, there are people with lot of medications. So some of these medications are not good for sperm production. So make sure that you are having consultation with your doctor and avoid unnecessary medications and turn them into proper medication that will prevent your issue and not damaging the sperm production. The most important thing to improve the subfertility in males is cessation of smoking. As we know, there are a lot of adverse health impacts of the uses of smoking. Usually it causes stroke and a lot of other comorbidities. But if we forget about all these, there are a lot of problems associated with the subfertility in males. Usually it causes pre-radicular damage to mechanisms of sperm production. Usually it will cause damaged sperms, abnormal form of sperms and low amount of sperm volume. As a result, if you are a smoker, you will be subfertile in a long run. So make sure that you are avoiding smoking to improve your chances of getting pregnant. Finally, make sure that you will correct all these issues before going to advanced fertility treatments. Then you will have a baby in a short time.